Hi, my name is Kjell Lindgren. I'm a NASA astronaut, and I served on the International Space Station for Expedition 44 and 45. One of the significant things that we experience when we get into space, or weightlessness, is this thing called the fluid shift. And that's because on Earth, our cardiovascular systems have to work against gravity. As you stand up, all of the blood wants to flow down into your legs and lower body. And so we have a number of physiologic systems that counteract that push the blood back up into the chest and especially up to the head to make sure that the brain continues to get blood and to be perfused. Now, all of those systems continue to work in space, but in the absence of gravity, pulling blood down into the legs, it results, when you get into weightlessness, of a shift of all of the blood and fluid that's in your legs, or most of it, up into your chest and head. So that results in everybody getting, we call facial edema, or their faces get kind of puffy. You have a sense of congestion. All of the tissues inside your nose and sinuses become engorged, and so you feel kind of like you have a head cold. You get a sense of head fullness, and some people might even develop a headache. And then if you were to look at our legs, we kind of describe them as bird legs because they look really skinny. Even if you worked out a lot and your legs are muscular, everybody's legs look very skinny and thin. So that is the fluid shift that occurs in space, and it lasts until you get back down to the ground and have gravity pulling that fluid back down into your legs. It has some important physiologic implications, one of which is that we think that fluid shift causes an increase in pressure in and around the brain. And that pressure can be transmitted along the optic nerve into the eye and increase the pressure in the eye and actually change the shape of the eye such that it makes the eye flatter. And I found that I actually had to wear reading glasses in space where I don't on the ground. For some astronauts, it's actually resulted in permanent changes to the eye. And so we have a whole research program right now with a lot of diagnostic tools on the space station to track and investigate these changes and to figure out, in addition to that fluid shift, what else is going on to cause these vision changes. And I was very grateful when I returned back to the Earth and the fluids redistributed, that my eyesight went back to normal. But this is an important problem for us to figure out for future astronauts.